The investing process shown in this video utilizes a four-step pour method. The injection flask and the model with completed denture setup are used in fabrication process. In the first step, dental stone is poured to the clean and lubricated lower half of the flask. A thin film of petroleum or silicone spray is applied to the flask to allow easier stone removal. This action also prevents brass flasks from corroding. Next, the model with completed denture setup is embedded in the dental stone. The land areas of the cast, tongue space, or lower denture, and the entire rim of the flask should be clean and completely exposed. Flask assembly, including the injection tube and funnel, are also embedded in the stone. All areas must be smooth with no sharp edges present. Make sure not to damage the injection channel since it forms a seal to resist back pressure during the injection process so the denture resin does not escape from the posterior shoulder of the flask. When stone sets, the injection channel is attached between the injection tube and the wax pattern located on the lingual surface of the denture. The injection channel, which can be made from rolled baseplate wax, 3 to 5 millimeters in diameter, is connected and secured with additional wax and smoothed, depending upon the type of prosthesis being invested. It may be necessary to form one or several injection channels. For completed upper dentures, one injection channel is usually sufficient. When investing in lower complete denture, 2 injection channels are necessary. Soapy solution or commercial stone-to-stone separator is then painted on the entire assembly, denture, injection channel, and the stone. The entire area is air dried. Next, the silicone insulating paste or silicone putty is used as investment coating material. It is applied while maintaining 1 to 2 millimeter thickness and tightly fitted to the denture setup. This step prevents any stone from sticking to the teeth and wax while eliminating the need for acrylic to stone separator in the upper mold cavity. It also allows for cleaner injection of denture material, helps in deflasking, reduces finishing time, and serves as a moisture barrier. Make sure to clear silicone putty on the incisal edges or occlusal surfaces of denture teeth, as excess can cause vertical processing error and or denture tooth dislodgement. When the top half of the flask is tightly adopted in place, dental stone is poured to a level that barely covers the incisal edge and occlusal surfaces of the denture teeth. Then a thoroughly soaked paper insert, which aids in divesting, is placed into the wet stone in the flask. When the flask is filled with stone, the flask cover is placed into position and pressed down until completely seated. Any excess stone from the exterior of the flask is removed. When stone hardens, the flasks are placed in boil-out tanks to soften the denture wax. After proper immersion, time flasks are removed from boil-out tank and open to eliminate softened denture wax and baseplate. Ideally, the wax should come out in one piece when the mold is separated. Any sharp edges found around the mold and the injection channels are removed with a knife. The entire flask assembly is now placed under hot running water and any remaining wax residue is cleaned. The mold is then set aside to drain and dry. I think that one was